I noticed in my community that there was an increased population of individuals that had mental illnesses that were going unaddressed. I knew that I wanted to pursue a career professionally to be able to address their needs.
If you want a job that you get to come to every day and really make a difference in someone's life, this is the job for you.
I get to be the person that supports you and loves you through a journey until you're able to love yourself.
And like to say we're in a state of an emergency. When it comes to the workforce, it's the biggest challenge, the number one challenge we face as an agency.
Also, being able to have compassion and have a true love for people and a true desire to help. I think that everyone deserves a chance. I think that everyone deserves to have someone in their life that's there to support them and that's there to help them.
A person's life is not just their suicide attempt or their depression. That's a piece of the puzzle. And so we try to look at the whole puzzle. And I think the challenge of that is fascinating to me. How we assess a situation and get those pieces of the puzzle laid out and then to try to figure out where we're going to start. I think our trick is to really convey those opportunities and help people understand that they can have a career with DBHDD. We are actually starting a behavioral health specialty track.
So I had addictions to methamphetamines, marijuana, opiates, and alcohol were some of the big ones. I've been diagnosed with bipolar. I needed some assistance, and it took my therapist. That was part of my big pivot in my journey. First time someone ever looked at me and said, I can understand why you feel that way. Everyone else said, Evan, you have anger issues, you need to work on them. And with him, coupled with some medications, some mental health treatments, I've been able to sustain recovery for over 6 years. I get purpose. I found a passion. There was a spark that was fueled in me that turned into this all-consuming fire that has become the passion of my life. I love knowing that I get to help people.
That's the easy button to access the system. And when we talk about 988, it's important to understand it's more than a 3-digit calling number. It is a continuum of care. So behind that person who answers the phone has to be an army.
So with the 988 crisis line becoming more widely known, there's definitely going to be an increased need for social workers, for human services professionals, paraprofessionals, and everyone within that realm that's able to help.
We've had some good support from the governor and the Georgia General Assembly in giving us 2 pay packages, and that has helped. One of the things we've done at our hospital job fairs has been providing instant feedback. So we're doing on-site drug testing, we're doing on-site background checks, we're doing on-site interviews same day as the job fair so that we can extend a conditional offer that day.
Until you get here and you see the beauty that is working in the field of mental health, you don't understand.
I think by working in this field, there's a real opportunity to make a difference, and that difference will outlast your life.
I get the opportunity to work hand in hand with them and love them and watch them from day one, coming from right over there in the crisis center to coming over here, getting their medication, and a year later walking out of here just new people with wings spread, ready to soar. It's beautiful.